Lisa Broyles with Way to Health MD, and this is my 5th video in my vaccine series. And today I'm going to talk to you about vaccines I recommend for toddlers. So first of all, I do recommend that you get your boosters for the vaccines that we discussed in the first video when your child was an infant. So that would be the DTaP, the HIB, and the Prevnar or pneumococcal vaccine. So those need to be boosted, and those are all killed vaccines, and I have found that I can give those vaccines together without causing any issues. However, I would not give any of those boosters with a live vaccine. So I'm going to spend the majority of this video talking to you about the live vaccines that are recommended for children over the age of 12 months, and that is the MMR and the varicella vaccine. Varicella is a live vaccine against chickenpox, which if you're my age, you probably got chickenpox when you were a kid. I've got a couple scars, and now I get to have shingles every once in a while when I get stressed out because I had varicella as a child. So does your child really need the varicella vaccine? I feel like this one is optional, and the reason I'm saying that is that varicella and chickenpox is a very uncomfortable and can be a scarring disease, but typically does not kill people. If you do get chickenpox as a child, then you are probably going to get shingles at some point in your life as an adult, which is a recurrence of the varicella vaccine in one dermatome or one stripe of skin where that virus hides. So you never truly get rid of the virus even once you clear the initial infection, but it lies dormant and masked by your immune system unless you get sick, stressed out, cancer, anything that drops your immune system can make the chickenpox break back out later in life, and that's what we know of as shingles today. So I think it is optional whether you want your child to be vaccinated against varicella. There's been no evidence that the varicella vaccine in and of itself caused autism or any developmental delays. The main issues have been with the MMR vaccine, which I'm about to discuss. That being said, I would not give the varicella vaccine at the same time as the MMR or any of the other killed vaccines that I mentioned. I would give it separately, and don't give any other vaccines within 30 days. And this gives the child's immune system a chance to focus on the one vaccine that was given, develop appropriate antibodies and an appropriate immune response. I think a lot of the problem that we have is that there's been so many vaccines developed that are given in such a short period of time that it overloads a child's immune system. And then you start having problems with autoimmune diseases, brain inflammation. So I think we can avoid that if we give the vaccines in a more spaced out pattern and really pick and choose which vaccines are life-saving and which ones are unnecessary. And I think that depends on where you live in this country, what kind of travel you do with your children. So those questions have to be answered on an individual basis. So finally, the MMR vaccine, I know I talked about this a little bit previously, but there have been countless studies and analyses looking at does the MMR vaccine cause developmental delays or any kind of developmental damage. So they did find that children with developmental delays had higher titers of antibodies, which is what your immune system creates in response to exposure to a virus. So they did find higher levels of measles antibodies in the gut tissue and the lymph nodes of children that had had the vaccine and had developmental delays in about a study of about 90 children. However, they then went on to look at antibody levels in all children that have been vaccinated that developed autistic spectrum disorders and could find no statistically significant relevance or proof that the MMR vaccine actually caused children to develop an autistic spectrum disorder. From my perspective as a functional medicine MD, I believe that autistic spectrum disorders are multifactorial, meaning there's multiple things that cause them to happen, one of which is genetics. There may not be a child specifically with autism, but I know even in my own more distant family, there are some children with Asperger's and autistic spectrum disorders that are in some different families in my more remote family members. And I do think that there is a genetic link that we just haven't identified, a gene that predisposes a child towards an autistic spectrum disorder. Then if mom gets sick with an infection while she's pregnant or exposed to a certain chemical, who knows what that does to that child's brain and the increased risk. So I think that there's many factors that can cause autism, and you can't say it's all caused by one vaccine. And the MMR vaccine is against measles, mumps, and rubella. Measles, 1 in 1,000 children that actually get measles will either die or develop meningitis with brain swelling and possibly go blind or deaf or have severe developmental delays as a result. So this is why measles was included in a vaccine, because it is neurologically devastating. So children that get the MMR vaccine do tend to get a high fever after, and it's because the vaccine really stimulates an aggressive immune response. Again, this is why I only give the MMR vaccine by itself, not with any other vaccines. I also recommend waiting until a child is 2 years old. I don't have any scientific evidence behind that other than this is my standard of practice. I found children are much more fully developed neurologically at 2 years of age versus 1 year of age. So I would wait until a child was 2 years old to give the MMR vaccine. It is recommended by the CDC between 12 to 15 months. So this is about a 7-month delay. And I do think that that lowers the risk of a child having any kind of brain inflammation from the vaccine that could then go on to cause an autism spectrum disorder. I practiced family medicine giving vaccines for 15 years. This is how I gave my MMR vaccines to my patients and to my own children, and I never had one child have a problem other than a high fever, which is common in up to 15% of children that get the vaccine. This fever really scares parents because it can be so high and so fast that the child can actually have a seizure. It's actually completely benign and it doesn't hurt the child, but it's very scary for the parent. So typically I asked my patients' parents to pre-medicate the child with Tylenol, and I gave them very specific dosing instructions to give them Tylenol to prevent that rapid rise in temperature the night after the vaccine. So the other viruses that are included in the MMR vaccine are mumps, which can cause very painful swelling of the testicles of male children or the ovaries of female children, also jaw swelling, and it can also cause brain swelling, something called encephalitis. So this is why mumps was included. The other thing is rubella. Rubella typically is just a mild rash, lymph node swelling, joint pain for a baby. So you really wouldn't think it was something we should vaccinate against. But the reason that rubella was included is because rubella really damages a fetus. So if a woman gets rubella while she's pregnant, then it will damage the fetus to the point where it may terminate the pregnancy, or the baby may have severe brain damage, neurological damage. So rubella is very damaging as a virus if a woman is pregnant. Okay, so that's why those 3 viruses are included in the MMR vaccine. I know this is a longer video than normal, but I think it's important to understand what vaccines I do recommend for toddlers. And in summary, it's the boosters of the DTaP, the Hib, and the Prevnar, and then the MMR and the varicella vaccines given when a child turns 2, and the booster no sooner than 3 months later. Thank you.